guys, Sarah Murphy here. Welcome to Nashville's Health and Wellness program, proudly brought to you by Middle Tennessee's Health and Wellness magazine. Today I'm here with Dr. Susan Briley, a board-certified colon and rectal surgeon. So Susan, I know when people hear the word colon and rectal, their ears immediately perk up. Can you please describe to me exactly what a colon and rectal surgeon does?
Of course. We treat a wide variety of colon and rectal diseases. That includes both benign and malignant diseases. Benign means non-cancerous. I do treat colon cancer, rectal cancer, and anal cancer. For the benign diseases, this may include diseases of the colon, such as diverticulitis, Crohn's disease, ulcerative colitis, and it also includes rectal disorders like hemorrhoids, fissures, fistulas.
Wow, and can you please describe to me a little bit about what each of those diseases is, and do they come over time for most people?
Well, most people who come to me with a benign anorectal problem usually have some pain, itching, or bleeding. And it gets to be a little confusing because everybody thinks they have hemorrhoids. But most people who come in and say they have hemorrhoids actually don't. They have something else, like a fissure or a fistula. But a lot of people do have hemorrhoids. And there's both non-surgical and surgical treatment for each of those conditions.
Wow. And what are some of the non-surgical treatments for people who have these?
Well, I'm reluctant to give away my secret weapon, but
Okay.
It's fiber.
Really? Interesting.
Psyllium fiber.
Wow. So can
Helps with hemorrhoids, fissures,
wow. So do people
bleeding
find that
pain.
mostly in their food, or do you give them supplements for fiber?
Psyllium fiber is a plant-based supplement.
Interesting. So can you tell me a little bit about what a colorectal cancer screening is?
Yes. A screening test is a test that's done on a group of individuals that don't have any symptoms at all. They're totally normal people, but we're looking for a disease or a condition in that normal group of people that may have silent symptoms, but if we detect the problem early enough, we can cure them or prevent the cancer. That's what makes colonoscopy the best screening test there is. Mammography is another screening test, but that only picks up tumors after they've developed. With colorectal cancer screening, we actually prevent cancers. And the way we do that is that the U.S. Preventative Health Task Force did approve several years ago the recommendation that all persons over 50 years of age undergo colonoscopy. So all asymptomatic individuals at age 50, and by the way, part of the Affordable Care Act is that this screening is covered by your insurance.
Oh, great.
Yes. So that's been a big change in the last 10 years or so. So the best test for colorectal cancer screening is a colonoscopy. And people dread colonoscopy because of the bowel prep.
Okay. And can you give me a little idea how that works?
I'll tell you about that.
Okay.
First of all, a colonoscopy is an endoscopic video test where we take a tube that has a camera, we put it into the rectum and maneuver it through the colon all the way around to the right side. As we come out, we look for polyps, tumors, or inflammation. We can remove those polyps during the test, and by removing polyps, which are early small growths, we can possibly prevent colon cancer. So if you have your screening colonoscopy and you have polyps, we remove them. And then you're good until your next recommended colonoscopy. And your doctor makes that recommendation based on how many polyps you have and what kind.
Interesting.
So to prepare for a colonoscopy, you do have to take a bowel prep because the inside of the colon needs to be very clean so we can see these polyps and remove them.
Wow. So when you reach the age of 50, every person should come in and get one of these screenings?
Yes.
Okay.
Absolutely.
Wow. Are there certain symptoms too that would
There are
entice one that they
symptoms of colorectal cancer that we all need to be aware of. Rectal bleeding is one. Of course, there's other causes of rectal bleeding, but we always suggest that you get rectal bleeding checked out by your doctor. Abdominal pain, cramps, unexpected weight loss, or a change in bowel habits. And that could be either from your normal bowel habit to constipation or diarrhea. Or if you've always been constipated and now all of a sudden you have diarrhea, then that could be a sign. So any change in bowel habits are important. So for those patients, they undergo colonoscopy too, but that's called diagnostic colonoscopy. So we've got screening colonoscopy and diagnostic colonoscopy. They're done the same way, but they're just classified differently because of the reason that we're doing them.
Wow, that's great. So somebody can just call your office, set an appointment, and it's all covered too.
Right. Usually if you're just calling the office to schedule a screening colonoscopy, we're going to want some background medical information, and we send the patient out some paperwork. Then the patient sends it back in and we look it over. Occasionally patients who want a screening colonoscopy, when we go over their history, we find out that they really do need an office visit. But for truly asymptomatic patients, they can get scheduled to come to either the GI lab or the surgery center for their screening colonoscopy.
Wow, and so when did you first decide you wanted to become a colon and rectal surgeon? Did that come over time, or did something inspire you along the way?
I had a professor who inspired me. I worked with him when I was early on in my surgical residency, and just hanging around him, I learned more about colon and rectal and thought it would be a good field.
Impressive. And so what brought you to the Nashville area?
I'm actually from Nashville. I grew up here, went to high school and college. I went away for my medical school and my surgical training, but decided to come back home.
Awesome. And so you are completely native here in Nashville.
One of the few.
Nice. And so can you tell me a little bit about where you're located? I know recently you opened up your private practice. Is that correct?
Yes, I'm located at 2021 Church Street, Suite 506, and the phone number is 284-4224 to get an appointment. A patient does not have to be referred by another physician. A patient who has symptoms or problems can call and make an appointment.
Well, is there anything else you want to tell us about the specialty in colon and rectal surgery?
I think it's important that patients do see a specialist. Diseases of the colon and rectum are the only things that I treat. I don't do breast cancer, thyroid disease, gallbladders. I just concentrate on this one area. So I think patients deserve to have a specialist to examine them for these problems.
I think that's great. And will you remind us one more time what the phone number is?
615-284-4224.
Thank you. Well, Susan, it's been a pleasure to have you on the show today. And thank you for tuning in to Nashville's Health and Wellness program, proudly brought to you by Middle Tennessee's Health and Wellness magazine. Be sure to get a copy near you today.